There are over 100 million women in America. 1 in 8 of us will be diagnosed with breast cancer. This year alone, more than 1 million will require a breast biopsy. Will it be this young lawyer? This mother of 2? Will it be you? Will it be me? Breast cancer is the most common form of cancer in American women, accounting for 1 out of 3 cancer diagnoses. If detected early, breast cancer can often be treated effectively. 5 years after diagnosis, more than 90% of the women who found breast cancer at its earliest stage are alive and well. Breast cancer occurs when cells within the breast become abnormal and divide without control. The cause of the disease is unknown. Aging, personal history of breast cancer, family history of breast cancer, previous breast biopsy, early menstruation, childbirth after 30 or no childbirth, and menopause after 50 can all be risk factors, increasing the likelihood of the disease. However, 70% of women diagnosed with breast cancer have no identifiable risk factors. Breast abnormalities most typically are detected through a routine self-examination, doctor examination, or mammogram. Things to check for include lumps, hard knots, swelling, dimpling, or thickening. Also, look for any abnormal change in size, shape, color, or discharge.
At Radiology Regional Center, we want to make your breast biopsy experience as comfortable and pleasant as possible. This video will serve as a walkthrough to give you an idea of what to expect. When you arrive at one of our centers, you will be greeted by our friendly front desk staff who will collect your information and inform our technical team that you're there. You'll be asked to sign in and have a seat while we prepare for your procedure. A technologist will come for you shortly and walk you back to a dressing room. You will be asked to change into a gown and given specific instructions on how you'll need to put it on. When you're ready, the technologist will take you from the dressing room to the biopsy suite, giving you an overview of the procedure. You'll be given an opportunity to go over any questions or concerns you may have about your biopsy with the technologist before the radiologist is called into the room. The radiologist will then come in to meet with you and reassure you about your procedure, helping you to feel as comfortable as possible. They will give you more detailed information describing how we perform breast biopsies, so there will be no surprises. You will be informed how you'll be prepared for the procedure. The area will be numbed and the tissue will be sampled, and we will leave behind a very small clip at the biopsy bed. Your breast will be imaged again to make sure the clip is in place as a marker for future reference. You'll be reassured that we will take care of you if any complications or problems arise after the procedure. You'll be asked again if you have any final questions or concerns before we begin. Radiology Regional Center provides 3 different methods of performing breast biopsies: stereotactic, ultrasound-guided, and MRI-guided. The method of removing tissue samples and marking the biopsy site is essentially the same in all 3 procedures. A small device is inserted into the abnormal tissue area, and a vacuum source gently draws out and captures samples. These allow a thorough diagnostic evaluation of the abnormality. Finally, a small clip may be inserted to mark the biopsy site for follow-up. Before any samples are taken, the radiologist will verify the specific location of the target area with digital images of the breast. You'll be positioned face down on a special table with your breast protruding through a hole where it will be lightly compressed to immobilize it. You'll have numbing medication provided, and the physician will talk you through the procedure. The doctor will make sure you're comfortable as tissue core samples are acquired. You may feel slight pressure, but you should not experience any significant pain. Your breast will be imaged again to verify the accuracy of the biopsy. The doctor will make sure you're okay and release you. The technologist will have you lie on your back and prepare you for the procedure. The radiologist will come in, make sure you're comfortable, and that you understand the procedure. The doctor will then begin scanning your breast with an ultrasound wand, viewing the images on a monitor. Once the area of concern is located and isolated, the physician will clean the breast, apply appropriate numbing medication, and finish preparing it for the biopsy. The doctor is able to continually view the progress and location of the biopsy needle with detailed images displayed on the monitor throughout the procedure. Core samples are collected, and the biopsy technologist will prepare the tissue for diagnosis. For MRI-guided biopsies, you will be positioned face down in the scanning bed, and your breast will be placed in a positioning device called a breast coil. Once in the coil, there will be a very slight compression applied to the side of the breast with a special plastic grid. The coordinates of the breast mass will be calculated with our new CAD stream technology. The physician and technologist will carefully extract tissue samples, while other members of our technological staff monitor the images and procedure from the control room. The samples are then collected and sent to a lab for pathology. Once the procedure is completed, we will make sure you're comfortable and answer any additional questions you may have. You'll leave with only a small bandage over the biopsy site, as no stitches are necessary. We want you to leave with peace of mind, knowing that we truly care about your health and well-being, as your health care is of paramount importance to us.